Your healthcare worker will don proper PPE, including gloves, surgical mask, and eye protection during the instruction and collection process. Please remember to maintain an appropriate social distance of 6 feet away during the collection process. Your healthcare worker will explain the specimen collection process and kit items. They will also instruct you on how to open the swab package, which is similar to opening a Band-Aid. If possible, wash hands or use an alcohol-based hand sanitizer before swabbing. Your healthcare worker will ask you to verify your name and date of birth as printed on the specimen label. Listen carefully as your healthcare worker explains the specimen collection process and kit items. They will review how to correctly use the swab and collect the specimen. As you are handed the collection kit items, place them on a flat surface, making sure the collection vial is upright. Then remove the cap. You may place the collection vial in a larger container to better secure it. To open the swab package, peel back the packing like opening a Band-Aid. As you open the swab package, remember to hold the swab by the handle and do not touch the swab tip. If you have tonsils, you should see 2 fleshy lumps near the back of the mouth. This is where you will swab. If your tonsils have been removed, look at the back of your mouth for the uvula. You will want to swab in the area just behind the uvula. As you swab, try not to touch the tongue, teeth, roof of the mouth, or cheeks. Carefully but firmly, rub the swab over the tonsils several times on both sides. You may feel a gag reflex or have an urge to cough, but there should be no pain. While swabbing the throat, remember to try and relax and keep breathing out. Making the ah sound will ease the need to cough. After finishing, place the swab in the collection transport vial with the tip pointing down. The swab should be covered completely by the liquid. Break off a portion of the swab stick so that it falls below the top of the vial. Open the second swab package. Remember to hold the swab by the handle without touching the tip of the swab. Follow the instructions from your healthcare worker to perform this next step. They will ask you to gently insert the swab approximately 1 inch into your nostril or until resistance is met, following a horizontal line and staying parallel to the roof of your mouth. Do not point the swab tip upward towards the eyes. Make sure the entire swab tip is in your nostril. You may feel some pressure with insertion, but there should be no pain. Rotate the swab 3 times, leaving the swab in place for several seconds. Remove the swab from the nostril without touching the tip of the swab. Using the same swab, repeat the process for the other nostril. After sampling both nostrils, place the swab in the same collection vial as the first swab so that the tip comes in contact with the liquid at the bottom of the vial. As before, break off a portion of the swab stick so that it falls below the top of the vial. Place the cap onto the collection vial and tighten, making sure it is securely screwed down. Your healthcare worker will hold open a lab specimen bag. Gently place the collection vial containing your swab inside the bag. After completing the collection process, if possible, make sure to wash your hands or use an alcohol-based hand sanitizer.